As we age, many of us start facing prostate issues. But did you know that some everyday habits could be making things worse? In fact, over 50% of men over 60 will experience prostate problems, yet most are unaware of the simple mistakes they're making every day. I'm Dr. Sarah Teo, and in this video, we'll uncover 7 common mistakes that can harm your prostate in old age, and how easy changes can make a world of difference. Before we dive in, let me know where you're tuning in from in the comments. Hit that like button, share this with your friends, and don't forget to subscribe for more health tips. Now, let's take a closer look at the first mistake you might be making. 1. Ignoring warning signs. One of the most common mistakes men make when it comes to their prostate health is ignoring the early warning signs. I've seen it time and time again in my practice. Take, for example, one of my patients, let's call him John. John is in his early 60s, healthy for the most part, but he started noticing some discomfort when urinating. At first, it was just a slight urgency here and there, nothing that seemed alarming. But over time, the urgency became more frequent, and he started waking up several times at night to use the bathroom. Despite these symptoms, he brushed them off as part of getting older. The reality is, these are the very signs that should not be ignored. According to studies from the Mayo Clinic, issues like frequent urination, weak urine flow, or feeling like your bladder isn't fully empty can often signal prostate problems. In fact, the American Urological Association reports that about 30% of men over 50 experience some form of prostate-related symptoms, yet many delay seeking medical help, assuming these symptoms are just a natural part of aging. The problem with ignoring these symptoms is that it can allow an underlying issue to worsen. When caught early, many prostate issues, including benign prostatic hyperplasia, BPH, or even early-stage prostate cancer, can be managed or treated effectively, but the longer you wait, the harder it becomes to address the problem. Research shows that men who delay seeking help may face more severe symptoms down the road, including bladder damage or even complications that could require surgery. If you start noticing any of the common warning signs, like having difficulty starting urination, needing to urinate frequently during the day or night, or experiencing pelvic discomfort, don't wait. It's important to schedule an appointment with your doctor as soon as possible. Even if it turns out to be something minor, early detection is key. Your doctor can perform simple tests, such as a digital rectal exam or a PSA blood test, to get to the bottom of the issue. Ignoring these signs may seem like a harmless choice at first, but the consequences of waiting too long can be significant. So, listen to your body, and don't delay seeking advice. Your health is worth it. As we move forward, let's talk about another mistake that many men make: leading a sedentary lifestyle. 2. Sedentary lifestyle. In today's world, it's all too easy to fall into a sedentary routine. With the rise of digital devices, many of us spend hours sitting, whether we're watching TV, working at a desk, or scrolling through our phones. For older adults, this lifestyle can have serious consequences, especially when it comes to prostate health. The American lifestyle, in general, often encourages inactivity, with a high percentage of older adults spending most of their time sitting or being inactive. According to the Centers for Disease Control and Prevention, CDC, nearly 30% of seniors age 65 and older report engaging in no physical activity at all. This lack of movement can negatively affect circulation, including blood flow to the pelvic region, which is essential for maintaining prostate health. When we're not moving, our bodies struggle to function at their best, and the risk of developing various health conditions, including prostate issues, increases. Fortunately, the good news is that you don't need to become an Olympic athlete to improve your health. Simple activities like walking, swimming, or even doing light stretches can go a long way. For example, one of my patients, Dave, a 68-year-old man, started walking just 15 minutes a day, after his doctor recommended it. At first, it felt like a lot, but over time he noticed significant improvements. Not only did his prostate health stabilize, but he also felt more energetic and less stressed. Dave's story is a perfect example of how small changes can lead to big improvements. For seniors, the key is to find exercises that are easy on the joints and can be done consistently. Walking, swimming, and even chair exercises are excellent options that can improve circulation and help prevent prostate problems. A brisk walk around the neighborhood or joining a gentle water aerobics class can help you stay active without overexerting yourself. The more you move, the better your prostate will fare. Now that we've tackled the importance of staying active, let's look at another common mistake: poor dietary choices. What you eat plays a crucial role in prostate health. 3. Poor dietary choices. The food we eat has a direct impact on our health, and for many older adults in the U.S., poor dietary choices can significantly affect prostate health. The typical American diet tends to be high in processed foods, unhealthy fats, and refined sugars, which can contribute to inflammation in the body, a key factor in prostate problems. Unfortunately, many men aren't aware of how these dietary habits can harm their prostate over time. Harvard Medical School emphasizes that a diet rich in fruits, vegetables, whole grains, and lean proteins can help maintain prostate health. On the flip side, diets high in red meat, processed foods, and sugary snacks can promote inflammation and increase the risk of developing prostate issues, including benign prostatic hyperplasia, BPH, or even prostate cancer. Studies show that a high intake of saturated fats and processed meats, such as bacon and hot dogs, is linked to an increased risk of prostate problems, while diets rich in antioxidants from fruits and vegetables can have protective effects. One of the best ways to protect your prostate is by choosing foods that are rich in nutrients that help reduce inflammation. For example, tomatoes, which are high in lycopene, have been shown to support prostate health. Lycopene is a powerful antioxidant that can help lower the risk of prostate cancer. Similarly, foods like broccoli, cauliflower, and spinach are rich in compounds that support prostate function and reduce inflammation. Omega-3 fatty acids found in fish like salmon, as well as nuts and seeds, can also help combat inflammation and support overall prostate health. Incorporating these foods into your daily meals doesn't have to be difficult. A simple meal might include a grilled salmon fillet with a side of roasted vegetables, such as broccoli or sweet potatoes, and a fresh tomato salad. For breakfast, try oatmeal topped with berries and chia seeds, which are full of antioxidants and fiber. By making small adjustments like these, you can begin to protect your prostate without making drastic changes to your diet. As we transition into the next mistake to avoid, let's talk about hydration. Staying properly hydrated is crucial for your prostate's health, and many people overlook its importance. 4. Inadequate hydration. Proper hydration is something that many people overlook when thinking about prostate health. However, the connection between staying hydrated and maintaining a healthy prostate is incredibly important. Dehydration can lead to concentrated urine, which irritates both the prostate and the urinary tract. This can increase the likelihood of developing uncomfortable symptoms, such as frequent urination or a sense of incomplete bladder emptying. Unfortunately, many seniors don't drink enough water, which can exacerbate these issues over time. The good news is that staying properly hydrated is simple and can have a significant impact on your prostate health. Experts recommend that most seniors aim for about 6 to 8 cups of water a day, though this can vary based on individual health needs and activity levels. Drinking water consistently throughout the day, rather than waiting until you're thirsty, helps maintain fluid balance and ensures that your urinary system is functioning smoothly. It's important to remember that hydration isn't just about drinking water. Other fluids, such as herbal teas, can also contribute to your hydration. However, it's wise to limit beverages like coffee and alcohol, as they are diuretics that can lead to increased urine production and potentially irritate the prostate. One common misconception is that you should avoid drinking too much water to prevent frequent bathroom trips, especially at night. While it's true that excessive water intake close to bedtime can disrupt sleep, ensuring that you drink water throughout the day can help prevent dehydration, which is much worse for your prostate health. To make it easier, keep a water bottle nearby during the day, and take small sips regularly, even if you don't feel thirsty. Hydration is one of the easiest ways to protect your prostate, so don't underestimate its importance. Now let's move on to another mistake to avoid: excessive alcohol and caffeine consumption. These habits can take a toll on your prostate health if not managed carefully. 5. Excessive alcohol and caffeine. In the U.S., alcohol and caffeine are deeply embedded in social and daily routines. Whether it's enjoying a beer with friends or having a morning cup of coffee, these habits are common across generations. However, when consumed in excess, both alcohol and caffeine can have negative effects on prostate health, particularly as we age. Alcohol, while enjoyable in moderation, can irritate the tissues of the prostate. Frequent consumption, especially in large quantities, may lead to inflammation, urinary discomfort, and difficulty fully emptying the bladder. The American Urological Association reports that excessive alcohol consumption can worsen symptoms of benign prostatic hyperplasia, BPH, and may even increase the risk of developing more serious prostate issues over time. Moreover, alcohol can disrupt hydration, compounding the problems it causes for prostate health. Caffeine, too, has its drawbacks. While it may be a go-to for boosting energy, excessive caffeine intake can act as a diuretic, increasing the frequency of urination and irritating the prostate. Studies suggest that high caffeine consumption can contribute to bladder discomfort and worsen symptoms of prostate issues, leading to more frequent trips to the bathroom, particularly at night. While some men may tolerate caffeine better than others, it's best to monitor how it affects your body and adjust accordingly. The key to enjoying these beverages without harming your prostate is moderation. The general guideline is to limit alcohol intake to 1 to 2 drinks per day, and caffeine to no more than 300 milligrams per day, about 2 to 3 cups of coffee. Additionally, opting for healthier alternatives like herbal teas or decaffeinated coffee can help reduce the negative impact on the prostate. Chamomile tea or fennel tea, for example, are great caffeine-free options that soothe the bladder and prostate, offering comfort without the side effects of caffeine or alcohol. As we wrap up this section, it's time to look at another key mistake that many men make: misuse of medications. Let's dive into how certain medications can affect prostate health and what you can do to protect yourself. 6. Medication misuse. When it comes to maintaining prostate health, medication misuse is a common but often overlooked mistake. Many older adults take medications for a variety of health conditions, but some medications can have unintended effects on the prostate. For instance, certain over-the-counter medications like antihistamines and decongestants can cause urinary retention, leading to discomfort and strain on the prostate. Additionally, some prescription medications, such as diuretics or beta blockers, can affect urinary function, making it harder to fully empty the bladder or causing frequent trips to the bathroom. The FDA has guidelines for many medications, warning patients about potential side effects related to prostate health. For example, medications that relax the bladder muscles or affect the central nervous system can exacerbate symptoms of benign prostatic hyperplasia, BPH, which is already a common issue for men over 60. It's important to be aware of these potential side effects, especially if you're taking medications for other health issues like hypertension or allergies. Another important aspect of medication use is drug interactions. Combining certain medications, whether prescribed or over-the-counter, can intensify side effects or cause complications that affect your prostate. For example, mixing certain blood pressure medications with diuretics can increase the risk of dehydration, which can worsen prostate issues. Always consult your doctor or pharmacist before starting any new medication, especially if you're already on a long-term treatment plan. This ensures you avoid harmful interactions and protect your prostate health. If you notice any changes in urinary function or experience discomfort while taking a medication, it's essential to consult your healthcare provider. They can help you adjust your treatment or recommend alternatives to manage both your prostate health and other medical conditions effectively. With that in mind, let's move on to the next mistake to avoid: the damaging effects of smoking on prostate health. 7. Smoking impact. Smoking is a well-known risk factor for many health issues, but its impact on prostate health is often underestimated. Research has shown that smoking not only harms the lungs and heart, but also has direct negative effects on the prostate. According to the latest studies, smoking is linked to an increased risk of prostate cancer and can accelerate the progression of benign prostatic hyperplasia, BPH. In fact, a study from the American Cancer Society found that men who smoke are more likely to develop aggressive forms of prostate cancer compared to non-smokers. The harmful chemicals in cigarette smoke can impair blood circulation, which affects the prostate's ability to function properly, leading to inflammation and an increased risk of complications. The toxins in tobacco smoke can also reduce the body's ability to fight off infections, further compromising prostate health. Over time, smoking weakens the immune system and hampers the body's natural defenses, making it more difficult for the prostate to stay healthy. The effects of smoking on prostate health are cumulative, meaning the longer a person smokes, the greater the risk of developing serious prostate issues. The good news is that quitting smoking can significantly improve prostate health. Studies show that men who quit smoking experience improvements in circulation, reduced inflammation, and a lower risk of developing prostate cancer. While quitting may seem challenging, there are plenty of resources available to help you succeed. Smoking cessation programs, nicotine replacement therapies, and even support groups can make the process more manageable. The success rates for quitting are encouraging, and the benefits of stopping, improved prostate health, better circulation, and reduced cancer risk, are well worth the effort. Now that we've covered the impact of smoking, let's wrap up and review the key takeaways to ensure you're on the right track to protecting your prostate health. To sum up, we've covered the 7 common mistakes that can harm your prostate as you age. We discussed how ignoring warning signs, leading a sedentary lifestyle, making poor dietary choices, inadequate hydration, excessive alcohol and caffeine, medication misuse, and smoking all play a significant role in prostate health. The good news is that each of these mistakes can be corrected with simple lifestyle changes. Staying active, eating a balanced diet, drinking enough water, and moderating alcohol and caffeine intake are all key steps in protecting your prostate. Additionally, quitting smoking and being mindful of your medication usage can have a profound impact on your long-term health. If you've noticed any signs or symptoms that concern you, don't hesitate to consult with your doctor. Early detection and intervention are critical in maintaining prostate health, and your healthcare provider can guide you in the right direction for treatment or prevention. I encourage you to take action today, whether that's making healthier food choices, getting more active, or scheduling that long overdue doctor's appointment. Your prostate health is important, and small changes can make a big difference. Finally, I'd love to hear from you. Share your experiences and thoughts in the comments below. What changes are you planning to make to improve your prostate health? If you found this video helpful, please like, share, and subscribe for more health tips. Together, we can create a supportive community focused on better health for all.